Hi, a very good morning again. So I am Jasveen, staff nurse who is taking care of Parkview residents care hub. Okay, I'll be explaining more on bleeding. There are few types of bleeding, so I'll be explaining in detail on this type of bleedings. Okay, for arterial bleeding, the most severe and urgent type of bleeding, it can result from a penetrating or a blunt injury. Okay, venous bleeding occurs when a vein is cut or torn. The blood looks dark red and moves steadily. Capillary bleeding is the most common type of bleeding. It happens whenever the skin is injured due to motor vehicle accident. Okay, so these are the picture where how do we differentiate arterial, venous, and also capillary bleeding? For arterial bleeding, it is protein blood. Okay, it is bright red in color. For venous, it is more steady and slow, more to dark red color. And for capillary bleeding, it is slow and even lighter and also bright red color. Okay, here are actions to take for bleedings. What do we do when we see a bleeding? Apply direct pressure to the wound using gloved hand and place a clean dressing over the wound. Okay, direct pressure can control minor to moderate pressure. Okay, apply a bulky extending beyond the edges of the wound and bandage firmly. If bleeding continues, leave the dressing in place and bandage another on top layer. Do not disturb the pads or bandage once bleeding is controlled. This is very straightforward. Okay, if there is bleeding, just apply pad on top of it. Okay, if you see the pad is already soaked or there's more blood, you put another pad or a gauze on top of the wound. Okay, so do not remove the previous pad and top up with a new gauze. Okay, this is what I meant. So now moving to wounds, I'm going to explain on the type of wounds we have. Okay, so wound is an injury to body tissue which can be a closed or even open wound. An open wound is a break in the skin. A closed wound is a wound where the skin is intact but blood escapes into the surrounding of tissues. Okay, the second one is very common. For example, when you hit into a chair or a table, okay, so you can see a blue red mark, all right, more like a bruises. So that is what it meant. Okay, contusion is most commonly caused by a fall or bump. Skin is not broken but appears swollen and discolored. Okay, so moving for the next one, abrasion, most commonly caused by a sliding fall, top layer of the skin are scraped. This is the example of the picture. Okay, for incision and laceration are most commonly the same. So it is cut by a sharp edges as blade or broken glass. There may be profuse bleeding. For lacerations, rough tear caused by crushing or ripping force such as machinery or wire, and the risk of infection is actually a bit higher. Okay, so here are another three type of wounds we have. Avulsion is torn tissue from the body are left hanging as a flap. Penetrating objects, a deep wound caused by nail, needle, or any other sharp pointed objects. Amputations are a body part has been completely cut or torn off, for example, finger or a toe. Okay, so here are a picture of how amputations look like. Okay, let's move to the next topic, action plans during emergencies. Okay, this is a very interesting topic. So emergency actions for an accidental amputation. This can happen at the roadside, okay, even at home. So what do you do is call emergency service as soon as possible. Okay, try to stop the bleeding. A complete amputation may not bleed very much. So this is how do you differentiate on a complete amputations or a cut of the nerve. Okay, have the injured person lie down and elevate the site that is bleeding. Okay, you can elevate up to 45 degrees. Apply direct pressure for a full 15 minutes. If blood soaks through the cloth, apply another without lifting the first one. This is how exactly the same as I have explained earlier. Check for and treat shock. Raise feet 12 inches and cover patient with blanket. Okay, how do we save amputated part? If possible, rinse with clean water to remove dirt or debris. Do not use soap or scrub. Place in a clean bag and pack the bag with ice. This is very important. Do not place any amputated part to direct ice. Try to put it in a bag and then put the bag in a ice pack. Okay, so moving to the next one, emergency actions to be taken for a bee sting. Okay, if the bee stinger is in the wound, remove it with a pair of tweezers or edge of a cut. Apply cold compress to relieve pain. If sting is in the mouth, give ice cube to suck or cold water. If sting is in the arm or leg, then apply cold compress and elevate it. Monitor for signs and symptoms or any other allergic reactions if persist and get medical attention immediately. Okay. Emergency actions for snake bite. Okay, so stay calm, keep the bitten area lower than the heart positions. Okay, remove all ring and watches in case there's swelling. Do not suck the bite wound and do not apply tourniquet. It is helpful to remember what the snake looks like to pass over info to the medical team. Okay, for the next slide, let's look at emergency actions to be taken for jellyfish sting. Stay calm, pour extra vinegar or seawater to stop the sting cells from releasing venom for at least 30 seconds. Okay, soak the wounded part into a warm water or warm pack if available. Monitor casualty for difficulty in breathing. Okay, so next I'll be demonstrating on type of bandages. Thank you. Hey, hi, I will be explaining to you on type of bandages, the purpose of bandages and also the technique of bandaging. Okay, bandaging is very important to create pressure over an area, to immobilize a part of the body and restrict its motion, and to support, protect wound from contamination, to also reduce bleeding and prevent edemas. Okay, important notes to be taken during bandaging. Pain, tingling, and also numbness are indication of a bandage that is too tight. If any of these symptoms appear, remove the bandage immediately and reapply the bandage to the areas less tightly. If bleeding is already controlled, the bandage needs to be not too tight since its main purpose is to hold the dressing in place. Okay, so I'll be explaining to you the type of bandages. This is called crepe bandage. It is available in 3 sizes: small, medium, and also large. You can actually choose the type of bandage by looking at the type of wound. So it comes with 2 pins. If it's not available, then you can actually use a micropore. So next, this is also another type of bandage which is called as a triangular bandage. This is very common to be used in head injury and also as an arm sling.